Good evening, my dear friends and colleagues. We had the idea to give you an impression about our taping of the Swiss Biohealth news in our new green screen studio. So I'm going to show you how and where it's going to take place. So, okay, now we're here inside the studio. And this is where everything is going to take place. Okay, let's start. So today we are going to talk about education. Education is something what is extremely important because it makes your life easier. You do not have to pay, you won't have additional costs. You do not need insurance for it, like when you buy a car or a house or whatsoever. But education makes your life easier and more efficient and more effective. So if there is one area where I've invested most of my money, it was education the last 30 years. And I just can say it was worth it. And we need to have a lot of knowledge if we want to do something very good and want to have a very good result. So in case you would like to plant some seeds, and so on the package they write every 10 centimeters put one of the seeds, and you just put it and do nothing, and then after some weeks it's just a very small plant. You would say it's not a good product. But to be able to grow a nice plant, fruit, tree, whatsoever, you need to know everything about the soil. You have to prepare it, you have to take care that it's alkaline, and so on. You have to put fertilizer, then you have to plant at the right moment, not in the winter but maybe in the spring. You have to take care, you have to water the plant, you have to take care about everything, and maybe animals whatsoever, and at the end you're going to have a nice plant, a nice result. And it's the same with education. So if you want to build bone, you need to know everything about bone, wound healing, and micronutrients and so on, vascularization, angiogenesis, and all those things. And so our idea was to go to the next level of education for 2021. And that's what I'm going to present you in the coming minutes. It will have a completely new format. All the courses will be grouped into topic blocks to reach the goal with as little time as possible. That means, so we will not anymore have this course and another course 1 month later, because especially for you guys coming from far abroad to Switzerland, it's important that you, what Anthony Robbins calls total immersion, that you would totally immerse into a topic and you study it for 3, 4, 5, 6, 7 days in a row, step by step, level by level to the master level, and then you know exactly what's going on. It's much easier. So imagine you would read a book and you read a few pages, and then some months later another few pages, and at the end of the year, so it took maybe a year, and at the end of the year you have no idea what you have been reading for 1 year. But if you would read the book within 2 or 3 days, for the rest of your life it will be much easier to remember everything what was in the book, because it was all one after the other, and you will not forget a part what you had been taught earlier or reading earlier. So this is the idea, to make it more effective for you to travel to Switzerland and to have a perfect result at the end of the days of the week. So the idea is that we are going to chunk it into weeks. So we call it weeks. Sometimes it's a few days, sometimes it's 7 days. And first of all, we're going to start for next year with the bone augmentation week. We want you within 1 week to become a top expert, 100% professional, not just with your knowledge, but as well with your manual skills, to become a top expert in bone augmentation. The second implantology week. Within 1 week, you will be a top expert in implantology, not just in ceramic implants, but in implantology in general. Even if you have never placed an implant, you will see in the Handson Phantom course, you're going to place implants in a saw model, in sawbone. In the Swiss Biohealth week, it's all about you. It's about to understand better the biological dentistry, and step by step, level by level, it's more about you, that you would become healthier, stronger, fitter, better performance, and easier success, and more focused, and so on, because it's our energy what is going to convince our patients at the end. So if you perform a surgery for 8 or 9 or 10 hours and the patient would not feel that you get tired, but you're fully focused for 10, 11 hours, then he definitely is going to trust you and believe you and respect your recommendations. So that's the Swiss Biohealth week. There will be an RAT, Autonomous Response Test, according to Dr. Klinghardt, week. And if enough English-speaking colleagues are going to sign in for this course, of course we will make it 2 times or maybe at the same time in German and English. So you would be able to join us. That was not able in the past because we had 3 weekends of 3 days, and it's impossible for you guys coming maybe from the US to travel 3 times for just 1 RT course. So now it will be 6 days in a row and it's done, and you know how to test with the RT test. As well, in the autumn of next year, we are planning prosthetics week and aesthetics week, because this is something what is extremely important as well. We're going to put it both together, you will see later. So to make you super fit about prosthetics and aesthetics, and both it's like 2 twins of the same thing, you will see. And we are going to plan some congresses. We have seen in the past that a lot of congresses have been cancelled. And like the ISMI Congress or the Congress of the IOCI or the Medical Week in Baden-Baden. And so for the coming year, and we're already starting this year, as you will see at the end of the news, we're going to organize our own congresses. For that, we're going to rebuild our education center. So we will have a place for 120 participants, very nice seating and setup. The catering will be in a big tent in the courtyard. And so we'll have enough space, because Switzerland was rated the safest country in the world regarding COVID-19. And so I think the travel regulations are quite good to Switzerland. We will see how it's going to be next year. Nobody knows. But at the end, definitely, if any congress is going to take place, it will be the congresses at the Swiss Biohealth Education Center, that's for sure. The idea was to make everything needs-based, so there won't be any speaker who is going to tell you what he likes to tell or what he's proud of or whatsoever. No, we are going to analyze, and we have analyzed what you need to know to become the best possible dentist or surgeon, and this is what we are going to teach in our courses. It will be perfectly structured, organized, level 1, 2, 3, 4, 5, and so on, and it will be result-oriented. That means when you leave the week, after 3, 4, 5, 6, 7 days, you will have all the knowledge you need for this specific area. That's something we definitely are going to take care of. So let's start with the bone augmentation week. It's going to take place just once in the coming year. It will start on Monday with a level 1, and it will be all about bones. That means about fracture, defect, about the healing, about it starts with osteocalcin and vitamin D3 and K2 and osteoprogenitor cells and all those things, and healing chambers and vascularization, angiogenesis, and bone formation, bone metabolism, the membranes and bone replacement materials, grafting materials, what material I should take when, how does it behave, how does it work, what makes sense, what makes no sense, and so on. This will be, this course will be lectured by Professor Ganati and by one of my oral surgeons, Steffi Vergote, and by me. On Tuesday, we're going to talk all about blood. So it starts how to cut, where to cut, when to cut, how does the healing works, like the inflammation, the proliferation, and the tissue growth and all those things. There is something we need to know, like when we plant a plant, we need to know everything about the soil and the maintenance and so on. So we're going to talk about blood concentrates, about sutures, about PRF, about low-speed centrifugation concept, and we are going to have a blood drawing, not collection, blood drawing workshop. It will be Ganati and the team of the Swiss Biohealth Clinic. On Wednesday and Thursday, we are going to have a workshop. We call it Phantom Course, so we will have plastic heads and with the models, upper and lower jaw, even with gingiva and drilling machines and drilling kit and everything, and the BIS system, bone implant stabilization system. And we're going to work on those models in an indication-based bone augmentation concept. That means normally we've got maybe a technique like Curie technique, and we use it, we believe, oh, it's a cool technique, I use it always and everywhere. That's wrong. Or maybe I would say there's a membrane, you can use it everywhere. That's wrong. There's an indication of a defect, and they're going to use different materials or maybe no materials in the sinus. But the question is, should I perform a sinus lift if the bone is missing into the other direction? So the implants later will be placed in the first floor instead of the ground floor. Makes no sense, very long crowns, and we're changing the anatomy and the physiology of the sinus. So there's an indication for every defect, and we are going to train you on the model, on the sawbone, we call it Phantom Course, about every indication, what proven it works, what proven technique should be used in this very specific situation. That is what we call indication-based dentistry. Like the bone implant stabilization system, what will be available until then, it's all together, it's a so-called guided augmentation protocol. It closes the gap between the past, where we were all like confused, what should we do, and there was no consensus. In the future there will be a consensus. It's 100% perfectly standardized, painting by numbers, guided augmentation protocol. So we're going to talk about external and internal sinus lift. Makes a sinus lift sense at all? And should I perform external or internal? Should I use the disc abutments, membrane screws, umbrella screws, Curie technique, when and where? And our new fantastic parallel system. We have developed a new, we call it SDS parallel system, where everybody will be able to place the implants in the 100% perfect place, 100% parallel in the perfect distance to each other. So you will see in my next Swiss Biohealth news. So this will be the workshop for 2 days, and level 4 we are going to stream live here from the Swiss Biohealth Clinic from 2 to 3 surgery theaters in parallel. That means we are all going to perform surgeries, and it will be Ganati, it will be me, it will be our oral surgeons, all at the same time, and all the various techniques from the guided augmentation protocol, and you will be able to decide which screen, this screen or this screen or this screen you're going to watch. And with your audio, you could choose the audio channel. With the headset, you could choose the audio channel. So it will be a multi-dimensional, and you could, okay, that's very interesting. Now there's a break. Okay, I'm going to watch here. So within one day, you're going to see amazing techniques like never seen before in one day. And Saturday and Sunday will be level 5. There will be the Congress, the Bone Augmentation Congress. So this is exactly now the cases and the science and about all what you have been trained during the week. And this will be, the speakers will be Ganati, me, Simon Piri, the maxillofacial surgeon Wilk, for example, maybe some more. And we are going to have a young panel with the young oral surgeons. They're going to present as well. So the idea is that you should, the best thing is you book the whole week, because then from level 1 to level 5, day 1 to day 7, you will be a top 100% professional in bone augmentation. You should just, if you would maybe start with level 4 and 5, you should make sure that you know everything about bone healing, about blood, about soft tissue healing, and you should have a very good experience in all those techniques listed here. But in best case, you would participate on all levels. Of course, the limitation is the phantom course, because we will not have 120 places, but we're going to take care that you would not wait in a queue. Every participant is going to have his own place where he could right away drill and screw and perform all the techniques. And we are going to show it from the lecturer, the speaker. We're going to place a camera. You will see it on a big screen, so you could exactly follow what he's going to do. And so that's, of course, will be the limitation. So the priority will be for the participants of the Bone Augmentation Week, now in November, 1st of November. And of course, the priority will be for those who are going to book the whole week. So we are first going to sell the whole week until the seats for the Phantom course, for the Handson course, are all booked. And from then on, we are going to sell the single levels or the single modules. The date will be the first 7 days of February. The idea is we will be able to show you on the bone augmentation workshop, the 1st of November, already the set, the kit for the BIS system. It will be 3 kits, 3 levels. It's amazing. There is nothing what you could not do and perform with our kits. There is everything. If you want to take membranes, if you want to place an umbrella screw, no matter what, with or without implants, internal sinus lift, it's all in those 3 kits. And it will be available on the market latest from 1st of February on. That is why the Bone Augmentation Week / Congress is going to take place at the beginning of February. Okay, that was everything about bone augmentation. The second week we are going to have 3 times a year in Switzerland and 4 times in the US. We'll be starting with the level 1, the planning. So which implants you're going to place in which area and situation. So you're going to understand and know everything why you should place this implant. For example, in the second premolar in the lower. I use in 99% the 4.6 millimeter to 11 implants, but the oral shape. Why the 4.6 and not the 3.8? Because the root is quite thick in this area. And to get an immediate implant stable, you need to get it stable by the width or by the length. But you can't get it stable by the length because there's the nerve. So you have to go for the width, it's 4.6. But the tulip for the 4.6 normally is 6 millimeter, it's too wide. So you have to go for the smaller tulip, for the so-called oval implant, what has a tulip 6 by 4.6. So that is that you would understand any application of any implant, and case planning on the CT scan, on the X-ray, how to plan a case, what shapes, what diameters, what lengths, one piece, two piece, temporary, no temporary. And as you might know, we have created a really nice system and concept how to could plan and animate, make an animation of your treatment plan for your patients, because they do not understand something what is on a sheet of paper written down. They want to see a picture before and after, and that is how you make it understandable for your patients, and it's even much easier for yourself before you start a surgery, because you don't have to read words or sentences. You will see what is the plan for today. That is something we are going to train you during this day. So this will be done by the team of the Swiss Biohealth Clinic. Level 2 will be, it's kind of a hands-on course. Like in the bone augmentation week, we're going to work on the phantom models. So on the heads, we have got to drill all the implants of SDS, and you will first start with the cutting techniques and suturing techniques on the model, because that's most important. Because if you close the suture like you would, you do it with your shoes with a lot of tension, you're going to destroy all the vascularization. But without vascularization, there is no healing. So we have to take care that we are going to use the proper and intelligent techniques for suturing, like the apical mattress suture, the vertical, the horizontal, with and without loop, the single and the running suture. All those things you're going to perform on the model. As well, all the drilling protocol up and down to understand when to use which drill, the various situations, and the parallel technique. So at the end of the day, you will have a toothless upper jaw, and you are going to place 8 to 10 implants, and they will be 100% symmetric on the perfect level, all of them 100% parallel to each other. Everybody, if you have experience or no experience, we have made it sure that you will be able to place the implants absolutely perfectly with the new developed parallel system. I believe I'm going to show this system in the next or over next Swiss Biohealth news. So this will be taught and supported and supervised by our Swiss Biohealth team, and of course I will be part of that as well. So on the third day will be another hands-on course. It starts with the prosthetic standards, target setting, crown down. That means before you start to drill and to place implants, you need to know what should be your prosthetic outcome. Actually, you should know how the patient should look from the outside, the aesthetic, the extraoral aesthetic, and that is determined by the intraoral aesthetic. It's not just the gummy smile. It depends where you place the implant and the later crown, how the upper lip is going to look later, and it is going to influence the whole aesthetic of the whole face. So this is the first step. The second step is temporary, what you're going to build on the 8 or 10 implants on the model from the day before. So you're going to keep this model, and the next day, level 3, so you keep this model, and the next day you're going to build 3 temporaries on those 8 implants with the splint technique, with the so-called ski boot technique, and axial temporary. The point is, if you are able to place 8 or 10 implants 100% in the perfect position, absolutely parallel, the prefabricated axial temporary is super easy to adjust to those implants, especially if they are all parallel. You could put the so-called temporary caps on top of the one-piece SDS implants. So to finish the axial temporary is going to take maybe 5 to 10 minutes. That is something you're going to do in the course, and you will see you're going on the level 2 course, you're going to place 8 to 10 perfect implants. The next day you will see within a very short time you will be able to place, to build a perfect temporary. So the width, the position, the shape of the teeth will be perfect, and it will be quick and fast, because it should not take 2 hours. Because if it takes 2 hours, you have to suture everything and then you work on the temporary maybe on the next day. But if you are super quick and fast, the point is that we then, maybe with the bone graft, sticky bone, the membranes on top, we place the apical mattress suture. Then we put the temporary caps on top of the 8 to 10 implants. Then we adjust the axial temporary, and if it takes just 5 minutes, we are going to cement and clean everything perfectly, and then we suture the final sutures. And the result is going to be that after 4 weeks, it looks like a 16-year-old Hollywood star coming directly from the orthodontic treatment, something like this. We're going to prove it by cases, you will see. Because the next level we're going to take care is perfect extraoral and intraoral aesthetics. That's the next level we are going to work on in the coming years beside bone augmentation. That will be done by our team of technicians around Joachim Meyer, our oral design member, team of the Swiss Biohealth Clinic, and of course my person. So level 4 will be the user course as you know it. The first day biological dentistry, second day ceramic implants. But it will be much better understandable and much more effective, because you will already understand much more about placing implants and getting a nice result. So I'm going to perform this user course mainly in Switzerland. I don't know if I will be able to come to the US and support one of those courses, but in the US there's 3 to 4 courses will be mainly performed by the team of the Swiss Biohealth Clinic, like Rebecca, for example. But once in a year, so these courses you're going to have in US, you will have from level 1 to 4, I think 3 times in Switzerland and 4 times in the US. And once in a year, but this will be just in Switzerland, we are going to start earlier. We're going to start on Sunday, and there will be 2 extra days, and it will be a congress at the end about ceramic implants and blood concentrates. You will see case presentations of ceramic implants, no titanium implants, studies and scientific investigations about ceramic implants and blood concentrates in the application, and aesthetics on ceramic implants. Perfect, extremely well done techniques and results in aesthetics on ceramic implants. So this will be a congress. It's not a substitute, but in case the ISMI Congress is not going to take place like this year, or the annual Congress of the International Academy of Ceramic Implants and many others, so we are going to have a wonderful, beautiful congress with a lot of nice speakers like Anati, like Cleopatra, like Simon Pieri, like the SDS users, like the Academy members of the Swiss Biohealth or SDS Academy, the ISMI members, the IOCI members, the SBCB, that is a new organization, what will be founded in 1 week, members. So you're going to have amazing speakers on this congress, and you should take care that you will be able to participate. So, of course, the places are limited for the hands-on courses. So we are going, the priority will be for those who are going to book the whole week, and just when all places for the hands-on courses are gone, we are going to open the bookings for the single levels and modules. The date, as you can see, it will be just once, is 2 days at the end of May and the first 5 days of June. So there's a very good chance for you guys in the US that in May and June next year, this year it wouldn't have worked, but next year we believe they're going to learn a lot about COVID and maybe other infections. So we strongly believe that you will be able to travel next year in May, June to Switzerland. So as well, we're going to have 3 courses just in the US. Priority, of course, will be for those who are going to book the whole week. And afterwards, we're going to open for single levels and modules. We will have 1 course in April in Jacksonville, Florida. We will have the next course in Columbus, Ohio. So it will be level 1, 2, 3, and the user course. AWK is the German for Anwenderkurs, means user course. And we will have the 3rd in October in Mission Viejo in California. So that's the 3 implantology weeks we are going to organize in the US. So in case you can't make it to Switzerland, you could take part in this on these dates and locations. As well, we decided that we are going to move forward with Costa Rica with these surgery weeks, where we have a supervision while you are going to perform surgeries on your patients. We started it some years ago because in Costa Rica they are accepting the CE registration, and first we thought we would have no need anymore for those courses in Costa Rica since we have received the FDA approval. But the nice thing is that some of you told us that they like it, that they could come to Costa Rica with very difficult courses in a perfect setup, nice place, good temperature, everything just perfectly organized by our friends down there in Costa Rica. And because they know they're 2, 3 top professionals, so if something would become difficult or before it would go wrong, they would help and support. And in any case, they would supervise your surgeries, what you would perform on your patients. So it's still a good idea, and we're going to move forward with those Costa Rica surgery weeks in the coming year. It was not able to organize for this year. The implantology week will be mandatory for the participants of the surgery week. So if you want to come to the surgery week in Costa Rica in January next year, 21, you have to book the 5 days over there. Otherwise, you're not allowed to go to the Costa Rica surgery week, because it's not training by doing or training on the job. You need to know 100% what you're going to do, and it has to be super safe for your patients. And this is why you definitely, no matter what, since it's a completely new education, you have to take this course. And we will have another Costa Rica week in December. This will be without the implantology week before, but it's mandatory that you have during the year taken one of the 3 implantology weeks, or maybe the one in January in Costa Rica. So always the 5 days, the implantology week is mandatory to book the surgery week in Costa Rica. Okay, next is Swiss Biohealth Week. Level 1 will be about neurotherapy. So we're going to, in one day, we are going to learn everything about the basics of neurotherapy, understanding of interference fields. We're going to do a lot of exercises, injection techniques in the head area. It's like always, the speaker and trainer is Dr. Wander, who was for 30 years the president of the Society for Neurotherapy and Acupuncture. Amazing guy. And he's completely going to focus on your needs. So we're not going to teach and train anything what you later not going to use in your practice. So we just focus and train and train and train what you're definitely going to use later. That's the new concept. Level 2 will be all about food as medicine, could be medicine or poison, nutrients, macro, micronutrients, superfoods, neutral values, food intolerances, toxins, and so on. And who could it do better than Dominik Nischwitz? And he's going to focus in one day on the top basics to give you a deep knowledge and understanding to teach your patients and for yourself to become healthier and to even improve your own nutrition. The third level will be NICO or cavitation. There is no better guy in the world, I would say, than Hans Lechner from Munich. I think most of you know him. He's going to talk about the histopathology of the cavitations. He's going to talk about the situation, the study, what are the studies, what is the proof, the forensics, the analysis of the X-ray images, CT scan, but he has developed a system where you could analyze and prove, maybe even after some months after the cavitation surgery with ultrasound. But the surgical techniques of the cavitation itself, I believe our technique is the best in the moment. So when it comes to the technique, our team of the Swiss Biohealth Clinic is going to teach you the technique step by step, how to perform a cavitation surgery in the upper and in the lower. Level 4, it's all about power and how to implement the biological concept into your private practice and ceramic implants, and about your mindset, rules of success, power performance, and so on. And it will be done by Alex Neubauer, a specialist, and his teacher, Ebert Wagemann, who is going to be a teacher as well at the Swiss Biohealth Health Days. He has got the highest level in yoga. He is, on the other hand, I think he was already older than 50 when he has done some world records, like 4 times Ironman within 6 days on 2 continents. Totally crazy, his performance, his power and success, and as well he's an extremely successful businessman and very famous for that as well. So those 2 are going to make you super fit in that. And then we are going to have as level 5 my longevity seminar, what is based on all the hundreds of seminars I have participated my own, if it was Grabova, Norbekov, Anthony Robbins, and many others. And it's about the bioage, because we know there's just one disease, it's age. The older you are, the higher risk for any chronic disease. So we want to know your bioage. There's some ideas how you could measure that. That has a lot to do with as well chronic inflammation and chronic stress. We're going to talk about the fatal intersection and how to escape. We're going to talk about sleep, deep sleep, nutrition, intermittent fasting, Fantastic Four, and more, about the Wim Hof methods. So everything what I'm going to talk, we are going to train as well. So we all together, we're going to do the Wim Hof method. We're going to talk about sports, exercise, performance, Norbekov gymnastics. That's something I learned 10 years ago, and since then I do it every single morning. It's just 10 minutes, but you feel like new life. We're going to talk about the human needs psychology of Anthony Robbins, the triad human needs, framing, pattern interrupt, and so on, but as well about time management, target planning, primary question, morning routine, strategy versus tactics, class 1 to 4 activities, time management, and so on. So that's my 2-day course. Until now, it was always just in German language, but until next year, we're going to translate and have the slides in both languages and simultaneous translation for this 2-day course as well. So after these 7 days, 6 days, you will be super fit. You will know everything about biological dentistry, foot, neural therapy, cavitations, but as well you will be a much stronger, healthier, more focused person afterwards. And it ends with the examination for those who are going to apply for the specialist for ceramic implants and biological dentistry. That will be in the late afternoon of the Saturday. So if you plan to become a specialist, you will have to attend one user course. You have to attend the implantology week, the full implantology week, if it's in the US or in Switzerland, doesn't matter. And you have to come to Switzerland and to attend one of the 2 Swiss Biohealth weeks, and then you're going to perform the examination, and hopefully you're going to pass, and then we're going to party as long as it will be allowed. We will see. Okay. So, of course, since it will be a very active week, interactive week, all the places for A-levels and modules will be limited. So the priority will be for the specialists, because they, for them, the week is obligatory, so they have the priority when it comes to the booking. And afterwards, you could, of course, book the single levels and single modules. So the dates, you see, we are going to have 2 dates, one in April and one in September. The one in April will be 19th to 24th of April. So it's a good chance now and quite easy for our friends from abroad, from the US or from other countries outside of Switzerland and not English speaking, to become a specialist within 2 weeks. It's implantology week and it's the Swiss Biohealth week. And if you're lucky, you pass the exam. Okay, so I told you already that we are going to focus in the future. I mean, we have to adapt to the new normal, or let's say the new abnormal of the world in COVID fear. It is like it is, we can't change it. So we have to adapt. That's what Darwin told us. So since they cancelled the medical week in Baden-Baden, we are going to perform our own small little medical week. It's a Swiss Biohealth Health Days. So of course we're going to have a simultaneous translation. So we're going to have it this year on 6th or 7th of November. And it's all about the immune system, performance, energy, and anti-aging. So all of the world-known speakers, they're going to talk about those topics. And you see, it's world-class speakers, Lei Ribeiro from Brazil, Yehuda Schönfeld from Tel Aviv, Richard Cheng from Shanghai in US, Thomas Levy from the US, Professor Birkmeyer from Vienna, Professor Ganati, Dr. Klinghardt, Kurt Mossetter, Ebert Wagemann, and so on. So it will be an amazing event. We still have 24 out of 100 tickets, so 96 tickets are sold and still 24 tickets are available. So definitely in a few days or weeks, this congress will be booked out, and that shows us that there is a huge need for congresses, since more or less nearly everything was cancelled. Save the date. Next year it will be the 6th and 7th as well. This year it's Friday, Saturday. Next year it will be Saturday, Sunday, 21. And this week is for physicians, dentists, health practitioners, but as well for interested patients. So, and for next year we're planning to have Professor Hollick, the one who found vitamin D3, Dr. Mutter, Dr. Siebenhühner, Wim Hof personally, so we're working on him this year, but it was impossible. And next year we will know better if this format works and if we will be booked out, because I mean he's very expensive, Wim Hof, but we're planning to have him at our congress next year. Then from some very well-known anti-aging clinics like the Lanzerhof, we are planning to have physicians, but as well sport physicians and athletes themselves. Maybe if they have won a gold medal, we want them to have them here as a speaker. Then there will be the Bone Augmentation Congress, what is part of the Bone Augmentation Week, the last 2 days. But we are going to have a small edition already this year. It will be on the 1st of November this year. And it will be my person, Ganati, the maxillofacial surgeon, Toby Wilk, who invented amazing techniques like the awning technique or the letterbox technique. It's incredible, but he's going to talk about the Curie technique as well. And Ganati, in the cancer surgery, he's already using our BIS system. And Simon Pieri is going to talk about huge cases with perfect aesthetic result, and the use of membranes, IPF, sticky bone, and so on. So it will be an amazing congress, and still 29 tickets are left. I believe this course is going to be booked out very soon as well. So, but the 2-day congress in 21, as I already showed you some minutes earlier, will be part of the Bone Augmentation Week. Will be next year on the 6th and 7th inside the Bone Augmentation Week from the 1st till the 7th of February. The Ceramic Implant and Blood Concentrate Congress, which is the last 2 days of the Implantology Week in May and the first days in June. So it will be June 4th and 5th, 21. And as well, we're going to have the Congress of the Sports Physicians. The interesting thing is that it's not like it's a special education, so dentists for sports physicians whatsoever. A sports physician, every physician or orthopedic or dentist who is working with and on athletes is a sports physician. So that's very interesting. And the annual congress will be in our Swiss Biohealth Education Center. So we're very happy, very proud of that on the 14th of November. You're going to find more links to all the courses and registration pages under this, below this YouTube video. Okay, last minute. Additionally, the following courses we are going to continue is the ceramic implants and biological dentistry for nurses and dental assistants, dental hygiene and prevention management according to the Swiss Biohealth concept as well. Both of those courses will be for dental assistants and always parallel to the usual course and Implantology Week, but just here in Switzerland, not in the US. Then we are going to teach the RT technique according to Dr. Klinghardt within 6 days, and you will be able to test perfectly interference fields, metal underneath, crowns, the perfect bite height, infection of the tooth, perfectly clean cavitation, all those things. And if we are going to have enough participants from our English-speaking community, we are going to organize simultaneous translations. So it's a very good chance now to get trained in RT within 6 days in Switzerland. Another week will be the Prosthetics and Aesthetics Week, 5 days. It's going to start with all the pathology and the knowledge about the joint, the muscles, and diagnosis, how to analyze, and the therapies to pre-treat the patient. That means before we start a treatment, we have to, beside the localization of the teeth and maybe implants made of titanium we have to remove, and the planning for the later ceramic implants, and then for the final crowns and bridges, we need to take care about the joint and all the pathologies over there, and that sometimes we need to have what we call a second long-term temporary to adjust perfectly and to treat the patient. So before we install the final crowns and bridges, everything should be super healthy regarding the joint. That will be the first day. The second day will be how to perfectly adjust and test the bite. So you definitely would know if it's for the temporary or if it's for the final crowns and bridges. You need to have a technique to use a technique to be super safe in perfectly adjusting the bite. As well, we are going to teach you the so-called myofreflex therapy according to Dr. Mosseter. Dr. Mosseter used to be the team doctor of the US soccer team, so he's very famous in Europe and in Germany, all over the world. So his teacher was the personal physician of the Dalai Lama, and he developed a therapy called myofreflex therapy that is treating the muscles perfectly. So within a few minutes, all the muscles are completely perfectly relaxed, and it's not just like a painkiller. It lasts for many days and weeks and months. Sometimes it's just once a treatment and it's over, but of course it has to go hand in hand by solving the cause for the joint problem. But it's going to help you to prepare the patient for the adjustment of the bite. And that is something what you could do by your own within a few minutes, so you do not have to send the patient to the osteopath, for example. You would do it by your own within a few minutes by pressing some points, and the muscles will be 100% perfectly relaxed. You take the bite, you test, and it will be super perfect. Then our oral designer and technician, Joachim Meyer, I think some of you know him already. He was this year together with me in Los Angeles for the user course, for the prosthetics course. He's going to teach you everything what you as a dentist, not as a technician, what you as a dentist have to know about prosthetics on ceramic implants in general and SDS implants in particular. Then we are going to talk about the aesthetic, mostly placing the implants absolutely perfectly the right level, the perfect distance, absolutely perfectly parallel, building the bone, building a perfect temporary. So as I was saying before, after 4 weeks it should look like a perfect Hollywood smile, and this is going to affect the extraoral aesthetics as well, and there is no better in the world than Professor Alessio Pieri from Monte Carlo, so he's going to do this course. And the last day will be Professor Ganati with IPRF and maybe mixed as well with hyaluronic acid injections, intraoral and extraoral, to improve the aesthetics. So at the end of the day, we do not just want to place ceramic implants and do immediate implants and improve the health of the patients and build the bone and make the patients healthier, but we want to close the whole gap, and we want to provide a perfect extraoral and intraoral aesthetics in the future. That is why we have created this Prosthetics and Aesthetics Week. We are going to communicate very soon when this is going to take place, but definitely it's going to be in the fall of 21. So just let us know if there is one of the courses. We have decided not to repeat all the courses from the past. So, but we have decided to what we want to, what is our goal for you for the education, and those courses will be perfectly fit into this concept, and all the other courses we have not planned to repeat them for the coming year, but in case there would be one course and you would bombard Ayla with emails that you would like us to keep those courses in our program, of course we're going to think about that. And in case there is something you would like to have in your education, just let us know. If we see there is a huge demand for something, we are going to work on that and going to provide it for your perfect education. So I think that was a nice overview what's going on. I think we definitely going to reach the next level of education, because a product is nothing, like a seed is nothing, if there is not the knowledge, not the education. If you want to grow a beautiful, nice flower or lettuce or tree or plant whatsoever, you need to have all the knowledge and the skills and the education as a gardener, and then it will be a beautiful plant. And it's the same with placing implants. It's not just screwing a screw into the bone. You have to have all the knowledge, all the skills, and this is why we have worked so hard in the past weeks on this totally new concept for education. So thanks a lot for your time. Hope to see you soon, and all the best to my dear friends and colleagues in our English-speaking community. See you soon. Stay healthy. Bye-bye.